content of the course will include the legal context, the risk assessment procedure itself, and then we will look at using PARAS to record the moving and handling risk assessment. The objectives of the course are that by the end of the session, you will be able to identify moving and handling activities, apply the principles of risk assessment, complete the manual handling risk assessment on PARAS, and demonstrate an understanding of the risk assessment process. So why do risk assessments? Well, as we will see later, the law asks us to carry out risk assessments. But it is also a logical way of reducing accidents and ill health. Assessments increase awareness among staff, and they are also for use when something goes wrong. The Manual Handling Operation Regulations 1992 is the piece of legislation most associated with the risk assessment process in moving and handling. It requires us to avoid any movement and handling that involves a risk of injury as far as is possible or reasonably practicable. Then it asks us to carry out a risk assessment on any hazardous operation that cannot be avoided. Once we've carried that out, we then need to reduce the risks as much as possible. This decision making is what will inform the care plan, and then we review it. So what does reasonably practicable mean? It is based on what is reasonable relating to costs. Costs could be financial, in terms of time, in terms of effort. And we look at and balance the level of risk to staff with the benefits to the patient. So putting risk assessment in context, we all have a duty of care to our patients, and the Human Rights Act gives every human being fundamental rights. Article 8 in the Human Rights Act reads that every human being has the right to privacy, family life and correspondence. They have the right to develop their personality and their relations with others. Everyone has the right to respect for their private and family life, home and correspondence. The requirements of the risk assessment. All our manual handling risk assessments must be transparent and open in their decision making. There should be obvious critical analysis of the facts and evidence on which decisions are made. Assessments must be genuinely individual based and consider not only physical but also the psychological, social and recreational needs of patients. There should be communication with the patient or their family regarding their manual handling preferences. And there should always be a balance between the risks to the patient and risks to staff. It is also important that sufficient and appropriate information is recorded. The risk assessment should be completed by a competent person, and in the Southern Trust that is the physio, OT or district nurse. And there needs to be communication of the findings and outcomes. And this shall be recorded, reviewed regularly and updated as required. So what is a risk assessment? Well, a manual handling risk assessment is carried out in the exact same way as any risk assessment is done. They follow the same format. You identify a hazard, you assess the risk associated with that hazard, and you implement control measures. And finally, you monitor and review the changes. And a hazard is defined as something that has potential to cause you harm. A risk is the chance or likelihood that that harm will actually happen. In order to work out the risk, the law requires us to consider 4 categories. It is these categories, the task, the load, the environment, and the individual, and sometimes there will be other factors, that we must look for risk factors. If it's a task, we have to consider the type of manual handling activity, such as pushing, pulling, lifting, or carrying. If it's the individual, we look at the capabilities of the person carrying out the manual handling activity. If it's the load, we look at the size, shape, surface type, and weight of the object being moved. If it's the environment, we consider the area in which the object is being moved. When we are looking for risk factors associated with the task for a patient, we might have to consider some other issues. The potential for sustained and repeated flexed postures, twisting, supporting body weight, static postures. When the load is a patient, then we have to consider other things as well, like the level of mobility, their client's expectations or wishes, variations in their mobility throughout the day, their behaviour, their weight or body shape, medication, tissue viability. When we're looking at our individual's capability, our individuals are our staff, and we have to think of lots of things: the appropriate training and induction, pre-existing injury or illness they might have, and pregnancy are a few examples. Risk factors associated with the environment are many, and it could include lack of space, clutter, patients' own personal objects, mats, carpets, etc. Control measures or safe systems. The moving and handling team have developed a library of safe systems to be used throughout the trust. These are step-by-step instructions on how a particular task is to be carried out. They must be available, readable, easy to understand, and updated regularly. These safe systems are recorded on SharePoint. This is an example of one safe system. So sit to stand from the chair using a handling belt. This is an example of another safe system, hoisting from the chair to bed. And this is the second page of the same safe system. Just a reminder that a manual handling assessment must be completed for all patients. Now we will take a look at the recording of the manual handling risk assessment on PARAS, and this follows the standard operating procedure. To begin the recording on the manual handling risk assessment tile, you must open PARAS and at the home page choose Applications. Search for a person and click on the manual handling risk assessment tile. Under patient status, click the spyglass on Name and search for your own name and insert the date. If no changes are required to the existing manual handling risk assessment, under patient status, change name to your own name and change date to the date reviewed and click Save. This will record that you have reviewed the document at the bottom of the manual handling risk assessment under Update Record. Click on View Details at the Patient Client Risk Factors to see all the typing when reading an existing manual handling risk assessment or completing a second one. Under Patient Client Risk Factors, choose Insert a Row and Complete. On this page, provide as much relevant information about the client as possible. So in the Relevant Medical History Diagnosis box, you would record any relevant medical history, including physical disability, spasms, sensory loss, body shape, etc. In the Level of Assistance Required box, you might list any aids that are currently in use by the client, for example, a walking stick or wheelchair. Explain how much assistance is required and who is currently providing it. In the Other Issues box, record the behaviour, comprehension, pain status, skin condition, the patient's own handling preferences, daily routine, any 24-hour variation, or maybe attachments. But make sure that everything you record is relevant to manual handling. And you have the option to fill in any history of falls. And use the spyglass at the bottom to insert a second assessor's name in Name 2 if a joint assessment is completed. Under Risk Factors and Control Measures, choose Insert a Row and complete a new page for each task required. So on this page, the first box will be the activities to be assessed. So that will include many, including sit to stand, toileting, personal hygiene and dressing, bathing, transfers in and out of bed, movement in bed, sustained postures, walking in and out of the car, on and off the floor, or basically any other tasks which may be required to be performed by carers. In the risk factors identified box, you should identify where there are risks to the carers and or the client. Examples may be working at low heights, stretching, stooping, or holding a sustained posture, lifting all or most of a client's weight, lack of space affecting the ability to move freely or use equipment, steps and stairs, door saddles or mats, staff not having training, or if a specialist piece of equipment is to be used. In the current control measures box, you will list the measures which have already been put in place to reduce the risks to both the carers and the client. These may include any equipment provided, any changes to the environment, or a care package already in place. In the case of a new client, it is likely that there will not be many current control measures, but during a review of a case, there are likely to be more. And then in the box immediate or further action, you will be asked to list all measures required to control the risk factors identified. These are ones that you will have identified. These may include introduction of a care package, or maybe a trial or ordering of equipment, providing training for carers regarding use of a particular technique or equipment, environmental solutions such as moving the client's bed to a downstairs room or removal of a wardrobe to allow more space. On occasions where it may take some time to reduce the risks to a reasonable level, it may be necessary to recommend that the client remains in bed. The assessment should then be reviewed once action has been taken to control the risk, for example, introduction of equipment or changes to the environment. In the case of a new client, there may be several actions listed, but during a review, there may not be any changes required. At Patient Client Summary, choose Insert a Row and then complete the summary. Carers do not have a copy of the risk assessment, but they will have a copy of this page. This section will give them a brief overview of the client. Include on it information about the client which will affect how they move and are handled, but do not record information of a sensitive nature. Please remember that this file is generally left sitting out and therefore can be read by anyone entering the home. Please avoid using abbreviations in this section, as carers are unlikely to be familiar with them. And keep the English simple. The patient-client plan will be populated with all the activities that have been identified in the risk factors and control measures. You will complete the instructions for all those activities, including the number of handlers needed, and refer to specific safe systems procedures. On this page, Patient-Client Plan, you will record the number of handlers required to undertake the task. It is not necessarily 2 members of staff, but may mean 1 member of staff working with a family member. You will also record in the box the details of method and equipment. This is how the client should be moved in order to reduce the risk of injury to staff and the client. You can insert standardised moving and handling plans as required. Specific information relevant to your patient should be included in this section, and click on Save. To print out the patient plan, you go to the top of the page and choose Print. Use the drop-down option on Print Profile to choose Client Only. Click on Accept Changes and then Print. You may want to save a PDF file so it can be emailed to outside agencies, for example. If you want to save a copy of the manual handling risk assessment without having to print and scan, you open the manual handling risk assessment on Paris, select Print, and then under Print Profile, select Client Only. Under Printer, select the icon to expand this section. Under Name, select Print to PDF and then select OK. Now accept changes. A preview of the risk assessment will now display. Now select the printer icon. This will bring up an option to allow you to save the document as a PDF file. Once you have shared the manual handling risk assessment with key workers or agency via email, please then delete this file from your desktop. When reviewing a patient and reviewing the risk assessment, you need to change the date and name of assessor as appropriate. So open the original patient-client risk factors and click on Copy Current Row. Adjust information as required, including correct staff name, and click Save. Under Risk Factors and Control Measures, open original activities to be assessed that need updated. Click on Copy Current Row and adjust information as required. Click Save. There will now be two activities with the same name. Open the older one by date and fill in discontinued date and name. It will then be hidden. Click on Show All to view all activities. Complete for all adjusted activities. Click Save. Activities will then populate down into Patient Plan. Any activities that need adjusting or updating will be recorded on this page. Under Patient Summary, open by clicking on Show All and click on Copy Current Row, and then adjust the information as required, including correct staff name. Click on Save. The most current patient summary will show on Print Client Copy. Under Patient Plan, open each task that needs changed and adjust information as required, including correct staff name. Discontinue previous activities by completing discontinue date. Click Save. To view previous activities, click on Show All. This page shows all the activities that can be adjusted. This shows the patient-client plan. This is an example of a printed plan. The first box gives the patient's general details, and in the next area is the patient-client summary, which is for the carers to read. This section shows follow-on from the previous printed plan, now showing the actual activities one by one, including any details of method and equipment that needs to be used. This is another example of a printed plan for sit to stand, but in this case the details of the method and equipment show two different outcomes. One relates to working with the patient in their own home and the other when they are in Listen Alley. This one shows again two different plans for the same patient, one at home and one in Listen Alley for toileting. Similar situation can occur when there are two different plans for a home situation, and that will depend on how well the patient is on a particular day. So there can be a plan A on when they are feeling good and plan B when things aren't going so well. It is important that there is a very clear distinction when you choose plan A and when you choose plan B. The following slides provide details about a significant complaint relating to the use of a stand aid in the Northern Trust in 2015. It involved an 81-year-old lady who was cared for in her own home with private agency domiciliary carers. She had two falls from a standing hoist within a few days, with care assistants present at both. They were using a Sabina standing hoist. There was also a hoist in the home, with a risk assessment plan indicating a plan A, plan B scenario. Following the falls, she was admitted to hospital with a dislocated shoulder and died just over a week later from a heart condition. As a result of the investigation into this particular complaint in domiciliary care, the conclusion queried, was the care planning, risk assessments and staff training in accordance with relevant standards? And was the care provided appropriate, reasonable, and in accordance with standards? The findings of the complaint investigation concluded that there was failure to arrange suitable staff training and failure to document and record care plans, risk assessments, and reviews. The following extract from the Moving and Handling Care Plan was heavily criticised. Under the summary of main tasks and action, it stated, if the patient is feeling weak or tired, the Delta hoist with extra large full body sling is to be used to transfer her onto bed for personal care and hygiene. Then, on the same plan under activity, it stated, transfer from and to the bed to the chair using Delta hoist. And then under the details of method and equipment, it stated, Delta hoist an extra large sling, with an illegible word in brackets above it, to be used to transfer the patient from bed to commode chair when required. The when required part in this phrase was the bit that was criticised most because it wasn't specific enough. And what it's telling us that when we have plan A, plan B, we must make sure that we differentiate and make a clear distinction when you choose one plan over the other. Thank you for listening.